Hi, my name is Bryan. I'm a student physical therapist assistant here at Malcolm X. Today we're going to be talking about a sterile gloving technique. But before we begin with the gloves, we're actually going to start out with our area and clean that first. Before we clean the actual area, we want to remove any jewelry, any watches, any loose articles of clothing, jewelry, tie your hair back if necessary. Make sure it's out of the way. And then we want to take our cleaner spray bottle here, spray the area that we're going to be working with, and go ahead and wipe it up. And discard this as appropriate. The next thing we're going to do is go wash our hands over the sink. Correct hand washing technique. We'll sing happy birthday twice. Should be the appropriate time to make sure that we are nice and clean. Underneath the fingernails, in between the fingers. All right, let's say we've done that. Rinse our hands off. Make sure we get every bit of water off. And we'll head back to the table. All right, now that we have our area clean, we're going to take our package of gloves here off to the side, and we're going to inspect it. Make sure there's no damage to the packaging at all. Make sure it's still airtight and sealed on all corners. Then we're going to check the expiration date. As you can see here, used before 2021, we're all set. Let's move forward. I'm going to peel back, open it up, and then just kind of gently dump it on the table. Set this off to the side. And then gently open this up. And now you see here these flaps. You want to use these flaps to open this up. You don't want to touch the inside because that's the sterile portion. You're going to go underneath here, peel that open, making sure to only touch on that 1-inch margin. Anything inside that is sterile. All right, now that we got that laid out, next thing we're going to do, our dominant hand. We're going to take our non-dominant hand, grab this other glove right here by the upturned cuff, slide our hand in. We don't want to have to adjust yet. We'll adjust once we get the other glove on as well. The next thing, you want to slide underneath of this. Get underneath of the cup here. You don't want to touch the inside of the inside of the glove. You just want to stay on the outside. Takes a little bit of time sometimes. We'll get there eventually. Slow and steady wins the race. All right, now we have it in there, just like this. We can slide our other hand in. We'll make the final adjustments to the glove once we got both hands in there. All right, perfect. Now we can flatten out any creases, anything like that. Perfect. Sterile. We're ready to go. All right, that's donning the gloves. Now doffing. We're going to pinch with the other glove and slide off, just like that. Ball it up into this hand. Take 2 fingers on the ungloved hand, slide it underneath the cuff of the other glove, and pull it off. Ready to go. All right. So the difference between sterile and clean techniques. Clean is a reduction of the microorganisms within the environment, and a sterile technique is try not to introduce any more microorganisms in. It's a complete elimination of the microorganisms. We would use this with immunosuppressed or immunocompromised patients. We don't want to introduce any microorganisms into their environment to avoid infection. And that's the end of the sterile gloving technique. Thanks.